What is tolerance and its types? Tolerance is defined as a person's diminished response to a drug that is the result of repeated use. People can develop tolerance to both illicit drugs and prescription medications. As stated above, tolerance is a physical effect of repeated use of a drug, not necessarily a sign of addiction. For example, patients with chronic pain frequently develop tolerance to some effects of prescription pain medications without developing an addiction to them. There are three main types of tolerance. Acute or short-term tolerance is caused by repeated exposure to a drug over a relatively short period of time. Cocaine abuse often results in acute tolerance. Experiments have shown that after the first dose of cocaine, test subjects experience a euphoric high and an increase in heart rate and blood pressure. However, despite nearly doubling the levels of the drug in the blood, a second dose of cocaine 40 minutes later does not result in a dose-dependent increase in the positive effects of the drug, including a further increase in heart rate or blood pressure. Chronic, or long-term, tolerance develops when an individual's body adapts to constant exposure to a drug over weeks or months. People who regularly abuse prescription opioids build up a chronic tolerance to the euphoric effects of these medications, leading many of them to increase the dosage taken or switch to more potent ways of taking these drugs, such as snorting or injecting. Learned tolerance may result from frequent exposure to certain drugs. For example, people who abuse alcohol for months or years often do not appear intoxicated to others. Experimental studies have shown that drinkers can compensate for the effects of alcohol on their coordination when they practice a task repeatedly while under the influence. However, this tolerance disappears if the task is altered. Finally, most drugs have more than one effect, and tolerance does not necessarily develop equally to all effects. Abusers of illicit and prescription opioids, such as heroin or oxycodone, OxyContin, quickly develop tolerance to the euphoric high these drugs produce but not to the dangerous side effect of respiratory depression, slowed breathing rate. Opioid abusers who take large doses of these drugs to overcome tolerance and get high are frequently hospitalized, or even die, because they stop breathing.